So I'm kind of jumping to my area of expertise, the auditory system. I have a really rudimentary picture here up on the screen that encompasses that outer ear, which is the pinna that we all see on the side of the head. The ear canal or the external auditory canal, those are the outer ear. The middle ear, which is the tympanic membrane, and the bones of the middle ear, the malleus, incus, and stapes. And then the inner ear, which is the cochlea, and the nerves that run along to the auditory brainstem. So very quickly, just thinking about how sound travels in a sort of a typical fashion. Sound, it moves through the air as a pressure wave. So air molecules are moving back and forth. And as the sound comes closer to the ear, your outer ear, your pinna, is actually acting as a funnel and picking up that pressure wave and pushing it through to the ear canal and down to the tympanic membrane. When the pressure wave hits the tympanic membrane, it's actually causing the tympanic membrane to vibrate, and that vibration is transported along the bones of the middle ear and then into the cochlea, causing a movement of the fluid of the cochlea. And as that the fluid moves, it displaces the inner and outer hair cells in such a way that sound is actually then transmitted up to the cochlear nerve and sent to the brain. So I said that really quickly, but it took me a lot longer to say it than as long as it actually takes for it to happen in real life. But as you can kind of see, there are a lot of different places where that sort of transportation of sound, as you will, can break down. That will come up in a little bit here when we talk about the types of hearing loss, because the types of hearing loss are really determined by where that breakdown is occurring. So for sensory neural hearing loss, that is occurring at the level of the cochlea. So anything having to do with the cochlea or the nerves, that's sensory neural hearing loss. It's often permanent in nature. There are a lot of potential causes for sensory neural hearing loss. Many more than I can list here, but just kind of thinking about the ones that might pop up for a school age population. You know, if you have a child that has hereditary or congenital hearing loss that they're born with, that could be due to a variety of factors. Could be an infection that the mom had during pregnancy. It could be that there is a genetic component. There is a syndrome that they have that, let's see here, cytomegalovirus is a big one for in terms of infections. I won't go into, there's something like over 400 syndromes associated with childhood hearing loss. So there are a lot, so I won't get into those. Other potential causes, noise exposure, especially as we look to children that are using technology, wearing headphones a lot. Chemotherapy can have an impact on the cells of the cochlea, which causes a permanent hearing loss. So obviously a lot of different causes that can come into play. For conductive hearing loss, again, a number of different causes. Most commonly, you're going to see children with otitis media who have fluid in the middle ear space that is building up abnormally and is not allowing sound to travel as we would expect. Conductive hearing loss, a permanent conductive hearing loss, can actually come about if the otitis media is chronic. If the child's had multiple sets of tubes, maybe that's resulted in scar tissue or thickening of the eardrum, or perhaps now there's a perforation of the eardrum that is preventing sound from traveling normally. And then mixed hearing loss would just be a combination of both factors. So generally speaking, there's some sort of permanent sensory neural hearing loss and then a conductive component on top. For the vast majority of children, that's, they have sensory neural hearing loss for whatever reason, and then they have fluid on top of it, causing a more significant hearing loss. As an audiologist, we can help to diagnose the type of hearing loss. We don't often get involved in terms of saying this hearing loss was caused by XYZ. Usually we hand that off to our partners in otolaryngology on that front, but oftentimes we can make an educated guess. If we know the child has a syndrome like Waardenburg's and they have a hearing loss, we know hearing loss is very common for Waardenburg's, so we assume that that might be the cause of their hearing loss. So I wanted to put an audiogram out here as well, just to show you what that looks like. Many of you have probably seen one, but across the top we have very low pitch sounds to very high pitch sounds, and then down the side, very soft sounds, all the way down to very loud sounds. So that green section that you see, any hearing thresholds that fall into that category, that's considered normal hearing for children. So 15 decibels or better. When we start to see hearing loss somewhere between 16 and 25 decibels, that's a slight hearing loss. And I will note that a slight hearing loss, that category really only exists for children. For adults, typically normal hearing is between 0 and 25 dB. But again, because of all the research that has come about in the last 10 to 15 years about what's considered educationally significant for hearing loss, what they found is that children really struggled in a classroom environment and in developing speech and language and literacy skills, even if they had a slight hearing loss. For an adult with that degree of hearing loss, chances are, they had normal hearing through their youth, they developed spoken language and literacy skills normally, and having just that little bit of a slight hearing loss wasn't significant enough for them to really struggle to communicate or to sort of use the knowledge they already had about speech and language and literacy to continue with their lives as normal. But for children that are learning, they just need a little bit better access to continue to learn and develop those skills. So as you can see, there are several different categories: mild, moderate, moderately severe, severe, and profound. As an audiologist, this information is really important because it tells me what really the options are for habilitation for a child. If the hearing loss is in the severe to profound range, then perhaps they're going to be referred for cochlear implant. If it's somewhere mild to moderately severe, maybe they're going to be a good hearing aid candidate. So a lot of information is gained from this. So right now I'm kind of going to focus on the diagnostic component, which isn't something you guys are going to do, but I think it'll help to differentiate between diagnosis and screening. So when I'm completing a diagnostic hearing evaluation, I'm doing something called a threshold search. And what that means is across multiple test frequencies, I'm determining the softest sound or the lowest level at which the patient I'm testing is able to hear whatever the sound is at least 50% of the time. So that is really the definition of threshold for us in audiology. And we're testing across several test frequencies from 250 to 8,000 hertz. We're also testing via air and bone conduction. So I'm going to skip back real quick to my picture of the ear here. When I test through air conduction, I'm putting headphones on or insert headphones in the ear, and that sound is being transmitted through the entire outer, middle, and inner ear. When I'm testing via bone conduction, I'm actually bypassing the outer and middle ear to directly stimulate the cochlea and determine how the inner ear is functioning. So we use a comparison of these two results to determine really what the type of hearing loss is. If they hear completely the same way through both air and bone conduction, that tells us any hearing loss would be sensory neural in nature or arising from the cochlea. If there's a difference, if they hear more poorly through air conduction, but they hear a bit better through the cochlea, or they hear completely within normal limits through the cochlea, that tells us that there's some sort of conductive component. So just to kind of give you an idea of what that looks like.